caregivers. Please. Tobago and the rest of you in the media. The Minister of Health, Minister Terence Singh, and we have the local authority in Tobago on the management of our COVID crisis, the Secretary for Health, Mrs. Tracy Davison Celestin. So we have the central government and the Tobago House of Assembly here this afternoon and the local Tobago media. And I am advised that Secretary Davison has brought with her her core of doctors, Dr. Wheeler, who has been with us every time we're here in Tobago, and maybe one or two other doctors. So without further ado, I'd like to pass the podium over to Secretary Davison Celestin, who would update the nation on Tobago's issues, and we hope to hear from the Tobago crew before I come back to you to introduce Minister Terence Singh.
Thank you very much, Prime Minister, and the pleasant...
Is that mic on?
Yeah. Okay. Thank you very much, Prime Minister. And a pleasant afternoon to the listening public and to our residents in particular. Firstly, I wish to move to acknowledging International Men's Day and International Children's Day, both celebrated on Thursday and Friday respectively. And so I want to indicate that it is critical to recognize that we need to reimagine our world and the roles in which we are now casted, especially in today's context. And so the mental well-being of men and children are, of course, paramount to our society. And sometimes we all take things for granted when we say, you know, that men can handle their own stories and children will bounce back. But to my mind, everyone needs a little TLC, even the super strong amongst us. So let us all make room for a little extra care for men and our children. Children also need to be allowed to express themselves, so let us all listen. Now I move on to Tobago's COVID-19, and to indicate that with planning, with preparation, and of course with public participation, we have managed to report no new cases on the island in the last 25 days. And so that means that there are also no active cases in COVID care for us. But I need to remind you, the members of the public, that this does not mean that we are COVID-free. It means no new cases have since emerged for testing, and our healthcare providers across the board have really pulled out the stops, and the public, by and large, has been actively following all of the protocols. I wish to use this opportunity to express thanks to all those who have been playing a very active role in keeping our people safe. And I want to encourage and to urge all of you to let us keep on working so that we can tackle this monster together. I also want to use this opportunity to indicate and to urge people to come forward for testing if they are presenting with symptoms. Don't do nothing. The best thing you can do for your loved ones is to, of course, get tested. It is safe. We are not COVID-free, and we must continue with safety and protection. I want to use this as a jumping-off point as well, because not having a tested positive case is not a license to flout our regulations. Please note our health inspectors, they are out and about. The police service is also doing its duty, and it is compulsory to keep all of us safe at this point in time. And it is not about one person, it's about the entire island, and more so the entire country. And so we cannot falter in our fight until we know that the pandemic is over, and we have to learn to live with it at the end of the day. But I know that we are all fatigued and emotionally tired, and in many instances our wings have been clipped. But we want to spend time with our friends, and of course we want to socialize. We want to return to the normal. But this pandemic, it's claiming far too many lives, and we don't want it to be you. We need to be innovative, and apart from that, we need to be inventive in order to move our island forward. And so let us all take advantage of the opportunities to reset with the government funding, with the soft loans, with grants, with entrepreneurial initiatives, with digital paths, the side hustle, even skill-based training, business advice, and even business training. And there are facilities to enable you to move in the right direction. Right here in Tobago, amongst the divisions of finance and the economy, community development and enterprise and labor, health, wellness, and family development, the options are many. We are fatigued, sometimes a little bit complacent, and even a little lazy. But we don't want sometimes to fill out the forms and to pull together the bundle of documents. And sometimes we can be very slow in getting our business in order. But if we are to restart the process of moving the economy forward, our lives will even be able to move forward as well. With that said, I want to take this opportunity to introduce our primary care manager, who will shed some light in terms of where we are with our COVID statistics and influenza. And we have no other but Dr. Mitchell.
Good afternoon, everyone.
Good afternoon, Dr.
Good afternoon, sir. Good afternoon, Mr. Diallo.
Good afternoon, Dr. Mitchell.
All right, thank you, Madam Secretary. Just to jump off on one of the points that you made with regard to the numbers that we're seeing in Tobago at present. We have not seen a COVID case on the island for the past 25 days. We attribute that to a very aggressive primary and secondary contact tracing effort. The Secretary mentioned that we did a lot of planning and a lot of preparation, and we are beginning to see the fruits of that. We have, over the past few months, monitored the mental, physical, and social well-being of all our clients under quarantine. We also have a very aggressive rapid containment with regard to any positive cases that we see. This has been done in conjunction with TEMS, the Office of the CMOH, and the TTPS, and I would like to thank all of them for their response. We have seen an increase in mask wearing, and whereas we still have a significant number of persons who are not wearing their masks correctly, the numbers in general have gone up, and I would like to congratulate the public with regard to that effort. One of the things that we have noted, though, is that there is a reduction in the number of cases that are presenting with viral symptoms. This, however, should not lull us into complacency. With the drop in the number of viral cases, we're also seeing a reduction in the number of cases being swabbed. Again, not to be lulled into complacency, as the Secretary would have advised, persons who are symptomatic are asked to come forward to ensure that they are swabbed and that they're tested. It may not be COVID, but it may be something else that requires attention. You can be seen at any of our primary care enhanced facilities at Scarborough, Canaan, and Roxborough. You can also be seen at the Accident and Emergency Department. And if swabbing is also required beyond that, you can be seen at the Green Room, which is located up at the old Scarborough Hospital. With that, I would like to thank you, Madam Secretary.
And just to introduce Dr. Wheeler, Medical Chief of Staff.
Good afternoon, Mr. Prime Minister, and good afternoon all. I'd just like to briefly speak on further developments in testing in Tobago, where we have received our new antigen testing machine, and that machine will be commissioned on Monday, 23rd of November, and training will begin with 3 medical laboratory technicians who will be performing the antigen tests as part of a national verification exercise. The reason I mention this is that as we go forward in testing and monitoring the incidence of COVID, the antigen test, which intends to be part of this exercise, will also be done in Tobago, and we are just focusing on the verification exercise at the moment. Thank you.
And last but by no means least, one more, Dr. Tiffany Hoyt, County Medical Officer of Health.
Hi, good afternoon, everyone. All courtesies observed. So, well, I would like to take this opportunity to first and foremost thank all the members of the healthcare team of the Trinidad and Tobago Police Service and all our collaborating partners who've been working tirelessly to ensure that we've gotten to this point that we're at. I have to give a special shout out to my staff at the office of the CMWH, who I call my Spartans. Thank you all very, very much for all your hard work and dedication. I'd just like to note that thus far we have submitted 1,730 samples for testing. Of this, we had a total of 106 cases testing positive. And as Secretary has said, we have no cases currently active on the island. And I like to use the analogy to persons. Just like if you're trying to lose weight, you would diet and you would exercise. When you get to your goal weight, you don't go back to not exercising and eating badly. To maintain your gains, you have to continue doing what you did to get there. So please, let us maintain
and total persons in home isolation are 418 as well. With regard to our step-down and transition facilities at the Claxton, over the last 24 hours or so, there has been some discharge. 5, Cape Up Hotel 21, Regent Star Hotel 17, and at the Cascadia Hotel 9. This would have been on the week ending 16th of November. There's a significantly large cluster of individuals that we got as positive from the prisons in Trinidad. At present stands at 84 persons. So we remove that from the equation. We find that we would have had a daily average of about 37 cases per day over the last week. This is week ending on the 20th of November, giving us an increase of 68% from the week ending the 13th, and giving us an even more significant increase, almost close to 100%, if you look at 2 weeks prior to that. So we are keeping a very close eye on the situation to ensure that the numbers remain in this region. There will be fluctuations as we go forward. We hope that the fluctuations continue to go downwards as we were seeing before, and not upwards as we have noted over the last couple of weeks. But again, it requires, as Dr. Hoyt said, it requires us all to play our part, continue wearing our masks appropriately, and continuing doing the public health measures that we need to have us going in the right direction. Thank you, Prime Minister.
Thank you very much, Dr. Roshan Parasram, the Chief Medical Officer of Trinidad and Tobago. Before I go on to introduce the Minister to give us his perspective, could I ask Dr. Parasram to just give us a little touch on what Dr. Hines would have said to the team with respect to the statistics? Because if one hears these numbers in isolation, one can probably get the wrong impression. But there is a statistical yardstick which would cause us to react not just to the no case or the low numbers in the hospital, but the curves that we are working with. Dr. Parasram, please.
Yeah, so as we are looking at the epidemiological curves week on week, what I said, based on the discussion at the end, is that we are seeing a slight increase in the upward direction over the last 2 weeks. So it has become a little more acute over the last week or so, notably so, as I said, with a daily average of 37. And it is a cause for concern. It is a cause, as we have seen with COVID-19 in other parts of the world as well. You find that those small increases, we cannot ignore them. We have to pay particular attention to them. And we are doing so on a daily basis to ensure that the measures that we have put in place stay in place, one. And of course, we have to be mindful that COVID-19 is unrelenting, it's unforgiving in terms of the way it has progressed across the world. And any area that it gets to propagate itself, it will do so. Areas of people congregating without mask wearing, congregating without social distance, and we have found any little pocket that persons behave in that way, we are finding cases going upwards in those particular instances. We are seeing a situation where the clusters that we are seeing are really clusters, family and friends, close family and friends, clusters in workplaces where people have gatherings, where people feel a little more comfortable and are able to take off their masks. In those circumstances, you find that you're finding little clusters here and there in different areas. Epidemiologically, we are concerned over the last week or so to see that increase. It is, in our view, significant from an epidemiological perspective, given what we have seen happening over the last couple of weeks. There's somewhat of a reversal in the pattern, and we have to be very mindful that in a very short space of time, 68% can go to 100%. And we could end up in a situation where we have 50 cases a day, 100 cases a day very quickly. So really we have to keep a very close eye on it at this time, and the graphs tell the tale as well. We're seeing that small increase, but small in a graphical sense could mean a big change from a population perspective. Thank you, Prime.
Thank you very much. Thank you very much, Dr. Parasram. At this time, I would like to ask the Minister, Minister Terence Dialsing, who is responsible for this sector of the government, to give us his perspective on the management of a COVID crisis.
Thank you. I think the mics are dead.
Sure, these mics are on.
Go ahead. Yes, thank you, Honorable Prime Minister, my colleague, Secretary of Health, Wellness and Family Development, Secretary Tracy Davidson Celestin, Dr. Hoyt, Dr. Mitchell, Dr. Wheeler, ladies and gentlemen of the media, citizens of Trinidad and Tobago. So, Prime Minister, I did not come all the way from Tobago to meet rain. I came to meet sunshine to bathe in the beach this evening. You have deceived me. So, because I'm staying overnight. Anyhow, the last time I was in Tobago would have been Saturday, the 21st of November. At that time, I would have alerted the country. At that time, there were 7 countries.
Are you sure that was the last time you were in Tobago?
October, sorry. The last time was Saturday, 24th October. That was your birthday.
And how could I miss that?
Exactly. And here we are today, Saturday, 21st November. At that time, I would have alerted the country that there were 7 countries around the world that were seeing COVID-19 accumulated figures of 1 million and 1 million plus. A month later, that has grown to 11. So from 7 to 11 countries with 1 million cases and more in 1 month. Behind those now 11 countries are again 4 countries with caseloads of over 800,000. So when we come back here on the 21st of December, we don't want to hear now, there are now 11 and 4, 15 cases, 15 countries. But that is the way the pandemic is evolving. The average number of cases per day continues to increase around the world is now 600,000 plus cases per day. That's the global picture. And we need to be cognizant of that. And deaths, unfortunately, continue to rise at an average of 10,000 deaths per day around the world. Ladies and gentlemen, I want to jump off on where the CMO just left off. Speaking about this, what could be perceived to be a small increase in the cases over the past 3 weeks. What we have to be worried about is what is behind that. Because what you are seeing now is not necessarily what is to come. Typically with these increases, the hospitalizations lag by about 2 weeks. Then the advent of people into the intensive care units and HDU units, as the doctors will tell you, might lag by about a week to 10 days, and then the deaths lag again. So the reason I am saying all of this is that we are entering into a festive season of Christmas. And we are urging people, and the ministry's messaging is going to start very soon, about what we should be doing at Christmas and not doing. I want to reach out with this platform to all chambers of commerce to ask their membership not to have Christmas parties. I have spoken to my own PS at the Ministry of Health. We'll be having no Christmas functions at the Ministry of Health. I want to reach out to all religious leaders, tell your flocks, your devotees, your jamaats, to avoid family gatherings this Christmas season. Every leader of an NGO, every member of parliament, all 41 members of parliament, everyone who has influence over people, to urge those who look up to you for leadership that this Christmas ought to be a holy Christmas, but a quiet Christmas. Keep your bubbles within yourself. Celebrate within your family units. Don't bring other 3 and 4 family units and friends into that bubble, because you are seeing that is what is causing the spread in some countries. So I am asking the national population to join with us to encourage people from abstaining from weddings, parties, Christmas parties. Just be safe for this Christmas. The last thing I would like to speak about, because it's important now, as there is talk about a COVID vaccine, we are now in the middle of administering our national seasonal flu vaccination drive. The numbers so far are not very encouraging. And I see Dr. Mitchell is agreeing with me. We were hoping that by now we would be giving out about 10,000 doses per week. We peaked in week 4 at 6,963. And every week from week 4 to this week, which is week 8, there has been a steady decline from 6,009, 5,003, 4,007, 4,006, and this week 3,116, giving us a cumulative total of 4,468. That is not a good report. By now, we should have been up to around 60,000, 70,000. Now, let me contextualize the flu vaccination drive with the anticipated COVID vaccination, which should come sometime in 2021. We would like at the Ministry of Health, and I want to join my Tobago colleagues, that we should end our flu vaccination administration drive by around March or April of next year. The reason being, we don't want the population to be confused when the COVID vaccine comes and you are given the flu vaccination at the same time. It is going to cause confusion in the minds of the population. So I am urging the population, let us get our flu vaccination numbers up. It is free, it is relatively painless, relatively painless, but it will really help save lives from people who are susceptible to flu. It will save our ICU and HDU spaces. And let us complete our flu vaccination drive by, say, around February, March, for the latest April. So when the COVID vaccines reach sometime next year and we start that, there could be no confusion in the minds of people. Well, I got a vaccine last week. You're telling me to come for a vaccine this week. You know, what you all really doing? So it's just to alert the population, let's get this flu vaccination drive over and done with right now. So the two messages: one, let's spend a very holy Christmas, but a very quiet Christmas. Don't invite people into your homes. If you receive an invitation to go paranging house to house, that is dangerous. If you receive an invitation to go to a wedding, an office party, that is dangerous. Let's spend a very quiet Christmas this year, so in 2021, all of us will be around, and we will celebrate 2021 with the full bells and whistles and parang and everything else. Thank you very much, Prime Minister.
Thank you very much, Minister Dayal Singh. I want at this stage to speak directly to all the people of Trinidad and Tobago. I want to let you know that your government, and in my case, your leader of government, leader of the country's business, I am one of almost 200 people in the world who has been called upon to carry out a specific assignment. That assignment is to take decisions to protect the population of the nation that we manage against a virus. How do I do that? I do that, as I told you from day one, way back in the early part of the year, that I will be relying very heavily, if not totally, on the advice and the guidance of the scientists who are in the health department with specialization in public health, in virology, and in epidemiology. I do not, at this time, intend to deviate from that commitment that I gave to you, because it is the only and the best approach to treating with the virus. However, what I've been doing over the months is to compare our response with comparator countries, particularly Commonwealth countries, where the laws are relatively the same, meaning that what can the government do to or with a population in trying to get a population to either cooperate or to respond or to associate with governmental decisions. And my staff and I have been monitoring, even as the pandemic wasn't with us from January or February, as it came to us, and as we all became like others, it was useful to see what other governments were doing, because we are all, as governments, as prime ministers and presidents and whatever, called upon to do the same thing, which is to respond to a virus which does not discriminate within race or political or geographical boundaries. This document is my working document where I've been monitoring the response of 17 countries and 17 governments and many more countries in that way, to see how certain responses have been adapted or adopted by some countries, what the response has been, and in fact, where the jumping off points have been along the way. These comparator countries are countries who did nothing. There's a famous country that did virtually nothing. Others who, in doing nothing, identified the virus as being able to pass through without too much disruption. Those who did certain drastic things, those who did something in between. You, the people of Trinidad and Tobago, you would know what we have done. But whatever we have done, it was done deliberately against a certain background, and today those actions have us in a position that in Trinidad and Tobago, you could have heard from the Secretary for Health in Tobago, which is a separate island in our nation, that at least this weekend we could report that we do not have active persons who are known to be carrying the virus actively in Tobago. In Trinidad, you would have seen what we had done initially, drastic action we took. Then we saw a spike coming on, then we took some responses to that, partial shutdown and so on. What we have been doing, which most countries have not been able to do, is to be coming out and doing more and more and having more and more exposure. What this dossier tells me is that particularly those countries who were held up as examples of how to manage the virus without major disruption, who initially were thought to have got the best formula, where they had a low infection rate and they didn't disrupt the economy and they didn't bring hardship on their populations. Those countries initially, countries like Sweden, countries like Australia, countries like Iceland, countries and one or two European countries, what appeared to have been a shortcut, an easy way out, in recent month or month and a half, all those countries have been overrun by the virus, resulting in drastic actions having to be taken so as not to allow those countries to get to where the other countries had been when the virus had overrun them. I speak here about European countries, one or two South Asian countries, and in particular the United States, states in the United States. And I tell you this against the background that in Trinidad and Tobago, where we have held the line, and we are under advice from some people for good reason, encouraging us to be more open, more forthcoming to the economy, that if we are not careful, we too could end up in a situation where it appears as though we were doing well, and inside of a 14-day period, we could move from a report like the one we got from the Secretary for Health Tobago today to one where Tobago does not have enough healthcare infrastructure or personnel to deal with people in Tobago who require hospitalization inside of a 2-week period. And of course, the same thing, Dr. Parrish, I'm responsible for the whole country as Chief Medical Officer. We could find ourselves in Trinidad and Tobago inside of a 2-week period, where we would have gone from a relatively comfortable situation where we think that we are doing things well enough, that we could now take greater liberties. And the reason why I could tell you that is because my dossier here showed me what has happened in other countries that were in our position, and inside a 14 to 28-day period, they've moved from comfort to calamity. And the calamity, as I want to mention again, is where people are infected. You have a high positive rate in your nation. So many people are infected, and of that population of infected people, a certain percentage requires hospitalization, and a certain percentage of that require high intensive care and possibly ICU care. And if the health sector is not able to deliver that, that is when you now join the rest of countries who park up refrigerated trucks outside of the morgue because the morgue is full. As Prime Minister of Trinidad and Tobago, I will do everything within my power to try to hold us away from that situation. And it brings me to the point of Tobago, our nation of Trinidad and Tobago. With Tobago's report today, I could say to the population, our policy is and has been to try to keep Tobago as protected as possible, because being a separate part of the population from Trinidad, it fell to us to utilize what we can to prevent Tobago from becoming super exposed. We did that by reducing the amount of persons that move from Trinidad to Tobago. Remember, we reduced the amount of flights to Tobago. We reduced the amount of persons on the ferry, and we asked people in Tobago to only travel if it is absolutely essential. That's how we sort of provided some element of protection within the nation for Tobago. But having done that, I could say to you, we are now in the Christmas season. Mid-November, we are in the Christmas season. You would have heard the minister say, we're talking about Christmas parties, and that the Ministry of Health has asked the private sector not to have Christmas parties. It is not that we don't want to celebrate Christmas. It is not that we are Ebenezer Scrooge and cousins of Scrooge. It is that the issue that we are facing and fighting is the issue of contact, issue of infection crossing from person to person through contact where there is congregation. Anything that brings about increased contact or congregation of the population, whether that contact or congregation is in a party, on a train, in a bus, or inside of the family, that contact is in fact the enemy. And that is why if you go through my dossier here, you will see a number of European countries as part of their instructions to the population, and in some cases enforced by law, families are not allowed to have family members coming to their households, because the virus does not differentiate between uncle and tanti and nenen and grandchildren. It identifies human-to-human contact. And the advice in many countries is that the problem largely is growing because of familial contact, and they're advising families, stay isolated even away from your other members of your family. If you follow the international news in the United States, you would know this week coming up here is Thanksgiving. It is the weekend when all Americans go home like lemmings to where they came from. The Center for Disease Control in America is telling Americans, do not go home for Thanksgiving. If you want to save yourself and your grandparents and whoever else, if you love them by not going to see them. In short, do not travel for Thanksgiving weekend. Now imagine a country of 300 million people, which normally, like in China, for the Chinese New Year, they all go back home. Wherever they're from, they go home. The response to the virus in 2020 is the government telling people, or the authorities telling people, do not go home to your family. Of course, this will have serious economic effects for those who rely on the Thanksgiving traffic, on the Thanksgiving economy, on the Thanksgiving purchases, and so on. But they say the turkey will be there next year. Don't go home to it this year. Because if you do, many of you will not be there to take part in next year's Thanksgiving when the turkey is available. Bring that to Tobago. It is my understanding that virtually every villa in Tobago is booked for Christmas. Meaning that a lot of Trinidadians have quite properly and expectedly chosen Tobago as the place to be in the Christmas holidays. That's a good thing. And we will do nothing to prevent that from happening because it is good for the Tobago economy, and it's good for Tobago people and for Trinidad people who choose, unfortunately, have Tobago to come to for Christmas. But as we do that, we cannot forget the underlying requirement to not ignore the instructions of the health department. That even as you are coming to Tobago, I'm told that we still have some thermal checks at the ports. If you're coming from the airport or you're coming from the seaport, the thermal checks will be in place. Carl is exploiting the possibility of finding a test which may or may not become available soon, where we can check at the port short notice, quick result testing. If it becomes available, we'll institute that. We are checking now to see if that's available to us. Because if we can isolate those who are going to Tobago or coming from Tobago by virtue of the fact that they're passing through 2 entry points, it will assist us in managing and retaining what we have at the moment. However, we expect that a lot of people will be in Tobago for the Christmas weekend, starting next week. It would not take very many instances of misconduct to convert the Tobago report from the one you got today to the one where Tobago is highly infected, because it's a small population in a small space, and if the virus is not controlled in the way it ought to be controlled, if it gets out of hand in Tobago, the same report you got today within 3 weeks, 2 to 3 weeks, could easily be the opposite. It all has to do with the behavior of people coming to Tobago or who are in Tobago. Do not for 1 minute believe that because you've heard about a vaccine that we no longer need to be stringent. Now more than ever, we need to hold the line in Trinidad and Tobago that when the vaccine becomes available, we will be vaccinating people on a fairly good foundation. We don't want by mid-2021 to be in a crisis situation and the vaccine is not going to roll back the crisis. Don't have that impression that, okay, we can do what we want, and if we get sick, a vaccine going to come to get us back. No, Dr. Wheeler can explain to you, it doesn't go so. We want to be virus-free. So when we get a vaccine to apply to the population, you're applying it to a population that is on a fairly sound footing, and that would be the best place to be. And because of what we know about the incubation period of the virus, as we move into Christmas now, I mentioned to the population earlier on that my hope and my target and my yardstick of measurement is whether by mid-January we could be in a position to say that the next thing that we can do in moving in the direction we have been going, in opening up and taking a little more risk as we go forward in that direction, is to allow some of our children to go back to school. That would be completely out of hand and out of order if during the Christmas period in Trinidad and Tobago we free up, and that free up of the Christmas period causes us to disregard the scientific understanding that it doesn't matter whether it's Christmas or Carnival or New Year's or Easter. If we congregate, if we create too much contact, if we do not wear our mask, if we do not do our social distancing, if we don't sanitize, because Christmas is a period of congregation. The same way the Americans are telling their population now, don't go home for Thanksgiving. I'm not saying to anybody in this country, don't go home for Christmas. But I'm saying as you acknowledge Christmas as a time of family, as a time of community, remember this is a time of a pandemic. And if we're not careful, the Christmas cultural responses could, if we are irresponsible, put us in a position where the January numbers could say to us, no school, because we have in fact behaved badly and the infection rate is so high that we can't even think about bringing children back out to school. That would mean that our children would have been out of school for almost a year? Almost a year. So if you want to play your part, as you must, not only for you, but for the next generation, the children who are not going to school, have a responsible Christmas. Do not encourage congregation and mixing over the Christmas season. I know it's a big ask. It's a big ask. But it is better to feel deprived of the Christmas festivities than to end up in the early part of January 2021 to be told that our nation has moved from where we are today, one which is not being locked down by family, not being locked down in totality, but one that has been holding the line and doing what had to be done and getting a fairly good result, as against one that felt that we're tired. We've been doing this for too long. I know it is easy to come to that thought, but you can imagine, as leader of the cabinet, with the pressure that we're under to do this, do that, do this, do that, for all good reasons, and not being able to do it, because our objective is to ensure that we are not in the worst possible position. Nothing is perfect. But you compare Trinidad and Tobago with the 50 countries mentioned in this dossier in mid-November. And whether you like us or you like yourself, you will come to the conclusion that Trinidad and Tobago is in a relatively good position. The last time I spoke to you, not last weekend, the time before, India, a population of 1 billion people, was being looked at as a country that had literally done very well handling the virus in a particular way. And there were those who were saying, well, the Indian model in a large and moving and vibrant population seems to have been. In the last 3 weeks, it has changed completely. The situation has changed completely. Malaysia, another Commonwealth country, using the same kinds of laws that we're using here. There are parts of Malaysia now, there are 2 provinces in Malaysia which are now in serious difficulty. In the United Kingdom, where they had moved to a semi-open but conscious of the dangers of the virus, England, Scotland, and Wales are now having far more restrictive conditions than we have here in Trinidad and Tobago. In the United States, which is familiar to most of us, many of us have family members in different parts of the United States. The absence of hospital beds in very many cities, especially small cities, is now a crisis. And the infection rate, the explosion, is beyond comprehension. We are not out of that wood. If we do not hold the line, we too will end up in that situation. Let me repeat that. If the government of Trinidad and Tobago does not hold the line alongside the cooperating people of Trinidad and Tobago in the pandemic of 2020 November, we too will end up in the same situation of those countries which today had been thought to have been doing well, to have had governments that have done well, to have had decisions that evaded the disruptions, only to find out that there are very few things that are different between Malaysia, Australia, and our Caribbean neighbors, the United States, and all the countries of Europe. In short, there's nothing special about Trinidad and Tobago. We are just as exposed to the virus and to the results of the virus on a human population as any other country. So if you read or you listen and you see any country in a difficulty with the virus, you just say there, but for the grace of God, go Trinidad and Tobago. Because there's no difference. The virus does not give a pass to your race, to your color, even your geographical location. The only difference that we have among countries today is what we are prepared to do to get an upper hand or a controlling position on an infection which covers the globe. As head of the government, I will join the minister who spoke to the private sector. I will instruct the head of the public service on Monday to instruct the ministries of government departments and through the Ministry of Finance, the Office of the Corporation Soul, to instruct state enterprises that as part of our virus control response, that there is to be no state-sponsored or any Christmas party in the public sector in 2020. No Christmas partying, because partying before Christmas was out and Christmas partying is partying. There was one particular church in which there was a leader in the United States early in the pandemic who encouraged persons to come to his church on the grounds that his faith was so great that the virus will not, he said from the pulpit that the virus has no power in the house of God, and encouraged people to come to the church. Within the fortnight, he was dead from COVID-19. So while we acknowledge the birth of Christ and have been doing so for centuries, in 2020, let us do it without partying. And therefore, there is to be no Christmas celebration in the public sector. This, I know, will have an effect on the economies of those who support the Christmas partying, the parent groups, and those who supply the drinks and the food and so on. I know that. But what this is about is to prevent people from congregating and being infected over the Christmas season, which will threaten us in January and virtually guarantee that we will not be in a position to consider any opening of schools in mid-January. Having said that, We know that there are people who will be personally affected by this. Today, there are people expecting us to open bars further because bars are open. Bars are open to sell as much beer and rum as they wish. What is not open is bars being allowed to invite people to congregate inside of bars. Let me repeat that. Bars are open in Trinidad and Tobago to sell as much alcohol as possible. There's no restriction on the sale and consumption of alcohol in this country, whether from a bar, from a restaurant, from well, the restaurants, you put a restriction because they service indoors, but from a supermarket or anywhere else. What is on restriction is the invitation to people to come and congregate indoors at bars over alcohol. That is a restriction. And unfortunately, we will maintain that restriction because that congregation is the danger. However, we understand what is being said by those who are affected this way. Since their business is a business of encouraging congregation through the line, and we are restricting them to protect all of us, we need to bear a little of the burden that they are bearing. And therefore, I have asked the Minister of Finance to find an additional $10 million specifically to treat with employees who work in bars and restaurants and who have lost their jobs or who have suffered a reduction of their income. For the owners of bars and therefore, and even restaurants who have lost or are losing their business, I would ask them to identify themselves to the monies that we have made available for small business support and to access the generous small business support which is available to sustain their business going forward, and the government will ensure that the applications are treated with some element of alacrity. However, I want to say to my fellow citizens of Trinidad and Tobago, the land of the smart man and the smart woman, when we offered salary grants through NIB for employed persons who lost their jobs, to get a salary grant relief, you had to have had a job to get a salary. And when you lost that salary, the salary grant was going to kick in. What we discovered, not surprisingly, was that there were approximately 5,000 persons who dishonestly sought to get money through the salary grant arrangement, and a not insignificant number of persons who tried to get rent relief grants. These dishonest people, who are part and parcel of our population, by being dishonest in this way, forced us to have to slow the process down to determine who actually qualifies and who didn't qualify. And that caused those who qualify to have got their grants later, or in some instances not to get it at all because the rush from those who didn't qualify. So having said what I just said there about bars and restaurant staff who would have lost their jobs because of the lengthy closure of that aspect of the business, we will not just be handing out a check to you because you come and say so. It will be examined to ensure that those who qualify get it and those who don't qualify don't get it. And as I said, to the owners of the business, there's some element of relief available to you. For those who are suffering additional hardship, we have a Ministry of Social Development and Family Services. We have allocations to that ministry. And that ministry will treat with applications for persons who are not applying in the context of the loss of job, but plain and simple can't make ends meet. Either because they were self-employed in all kinds of entrepreneurial business which do not now exist, and even though they were citizens making their way on their own, because of the changed circumstances in the country where they were making that way, living on the margin. Those margins have receded from them. And there are a number of them who are today facing some element of destitution. I've asked the Minister of Finance to find an additional $20 million for the Social Services Department, who will treat with such persons, who will identify themselves to such offices, and as per examination, when it is determined that they are to be beneficiaries of that, after examination, especially where children are involved, that the departments, the public service departments, would be relatively generous between now and January, specifically with an additional $20 million, specifically to deal with persons who were self-employed and whose self-employment have atrophied as a result of how we are living today. For example, a person who would have been a vendor at a sports event and who would have walked around the city preparing certain things and having income only at events, or a person who might have been doing something which now is not part of our activity. And I want to say something to public servants, because I am not skeptical, I am very skeptical as public servants treat with screening. I know that some public servants are not as empathetic as they should be when people come to you and tell you, I need help. I don't ask you here to break the law or to be loose-fisted. I simply ask you, public servants who would be responsible for disbursing these assistance programs, to be empathetic to the people who come to you. You might make a mistake here or there, and the smart man or the smart woman might get away. But it's better if the smart man or the smart woman get away than for children to go hungry in our population. And if we ever catch up with the smart man or the smart woman, hand them over to the police, please. And that is an instruction from the Prime Minister of Trinidad and Tobago. Wherever there are clear instances of dishonesty, such persons should be prosecuted to the full length of the law, because I do not want our children somewhere within our border to go hungry, because the public servants have been so careful to keep out the smart man or the smart woman that children have gone hungry because the screen has screened them out. Those of us who are relatively comfortable, just remember that when you feed yourself, there might be 1 or 2 families in this country who do not know where the next meal is coming from. And that is not a Trinidad and Tobago thing. Yesterday, in my monitoring of other people's circumstances, I saw where 34 million people in the United States have fallen below the poverty line in recent times. 34 million people in the richest country in the world. So this is not a Trinidad and Tobago thing. It is something that all governments have to deal with. I mentioned to you a while ago Malaysia, where in the state of Sabah, in the province, the level of poverty and destitution as brought about by the COVID management has been horrendous. We in Trinidad and Tobago, we are not in that situation, but we have our own difficulty. And what I'm trying to do here is, in a managed way, trying to reach out to those who are affected. It is not logistically easy. Had we been a digitalized country, it would have been easy to know whose number turns up anywhere. Unfortunately, we are not yet in a position of the unique identifier. So it is difficult to manage and manipulate the data. But hopefully, if we're ever in this situation again, God forbid, we should be in a position to know who is who and who is not who, because our infrastructure would have allowed that. Among the changes we'll make this weekend, very small changes, we will allow food services in casinos. That had slipped through the crack in the last fortnight. We've allowed it in cinemas. It should have been cinemas and casinos, but we'd allow that. And of course, we met on Friday to discuss our management of the congregation and what changes we'll make. And on Friday, before Saturday, must have been what, Friday night? Yeah. We agreed that there was no good reason in the context of what we are doing to not have ourselves exposed through certain activities. There was no good reason to continue to prevent hunters from hunting. And therefore we took a decision to allow hunters to hunt again. Not that we're extending the hunting season. It will close as normal, but we would have prevented hunting for about 6 weeks. And tomorrow, on Monday, the minister, responsible Minister of Agriculture, will take the necessary steps to have the registration of hunters done normally, so that by the end of the next weekend, hunters could be allowed to hunt. And I say that in detail because I want those who have come this morning on Facebook with all kind of dotishness about the Minister of Health. Our decision has nothing to do with you, because as Prime Minister, I will not be swayed by any such behavior. Our decisions are made against serious analysis, and the decision to allow hunters to go back out was done on Friday, and I will instruct the Minister on Monday, and it will take a few days for the hunting permits to be issued and so on, and hopefully by weekend, hunters go out so that people have 8 weeks of hunting. It is not an extension of the hunting season. The hunting season ends at a particular date early next year. I think it's end of February. And the law is there, and that law remains in place. I want to say that CAL has made certain proposals to the government, which the CMO would examine, and the Ministry of Health. And that proposal is to use an early result testing program, which is relatively acceptable in some quarters, to allow us to have an increased level of transportation that would have benefits for Tobago and CAL's opportunities elsewhere. And hopefully, here in Tobago, you may see that test coming on stream. The Minister of Health will make the outcome of these examinations available to you as to whether we'll be able to do tests other than the PCR tests that are being used now. And for Christmas, I want to once again say to you that what happens in 2021 will be determined by our behavior over Christmas. At this stage, I want to ask my staff to show you an officer in Toronto, Canada, responding to their threats of the virus currently, so you can see how some people in a Commonwealth country close to us is responding. Could we get the officer from Toronto?
Our top priority has always been the health and well-being of all Ontarians. Despite the range of public health measures and restrictions that have been in place since early October, we've seen the situation continue to worsen in regions across the province, particularly in hotspots like Peel and Toronto. It's clear more needs to be done to limit community transmission of COVID-19 so that we can keep our schools open, safeguard our health system capacity, and protect our most vulnerable. As we've seen around the world, lockdowns are a difficult but necessary step to prevent COVID-19 outbreaks and bend the curve in the number of new cases. Based on the recent data, and to protect the health and well-being of people and families in these communities, Peel Public Health and Toronto Public Health will be moving to lockdown effective Monday, November 23rd at 12:01 a.m. Measures under lockdown include no indoor private gatherings will be permitted with anyone outside your household. Individuals who live alone may have close contact with one other household. Outdoor gatherings will be limited to a maximum of 10 people. Retail stores providing non-essential services in shopping malls can operate through pickup or delivery. Non-essential storefront retail can stay open for curbside pickup or delivery only. Restaurants must close indoor dining, but may stay open for takeout and delivery. Religious services and weddings will be restricted to 10 people indoors and 10 people outdoors. Gyms, sports facilities, cinemas, casinos, museums, and personal services must close. Manufacturing, agriculture, supply chain, and most construction can continue. These measures are being put in place to prioritize the essential services we rely on.
Thank you very much, members of the staff here in Tobago and my staff from Trinidad. I played that clip so that you can understand and compare what we are experiencing here in Trinidad and Tobago and what others are experiencing and what their governments are doing in response. Because, you know, there are some people amongst us who would like you to believe that you are suffering as a result of the stupidity of the government of Trinidad and Tobago and the uncaring nature of the Prime Minister himself. I hope you were able to glean from that Ontario, Canada response, which comes into effect on November 23rd, which is when?
November the 23rd.
Monday.
Monday.
So that comes into effect on Monday in Toronto, Canada, where a lot of our citizens live, none of whom could tell you that they are better off there than they are in Trinidad and Tobago. We, as I started off by saying, all governmental leaders have a responsibility to respond to a virus, the same virus, whether it is in Turkey, in Ireland, in Australia, or Toronto. This is what we are called upon to do. And you in Trinidad and Tobago can rest assured that as Prime Minister of Trinidad and Tobago, notwithstanding the advice that I may get from others, I will do everything possible to give the population of Trinidad and Tobago the best chance to avoid a deterioration of our circumstance. Thank you very much, and we'll take your questions now. If you don't have any questions, that's quite all right, you know, but I see Liz getting to the microphone. Go ahead, Liz. I will take the questions one by one, please.
No problem, Prime Minister. Thank you so much. And good afternoon to you and your team and to everyone. One of my first questions is, I know you did not speak anything about in terms of the borders. Many are asking about the borders being reopened and also nationals who have companions who are non-nationals returning to Trinidad and Tobago. Any word on this?
Okay, let me take the last part first. In the context of the borders remaining closed, the borders are closed, but we are operating an exemption process to allow persons to come over the border, going out or coming in. But strictly speaking, our borders are closed and movement only on exemptions being granted. Persons who are to come into our country, we said that we are managing that on a case-by-case basis. Largely, though not exclusively, to citizens of Trinidad and Tobago. If we say exclusively to citizens of Trinidad and Tobago, then we couldn't have allowed the Chinese ambassador in. Understood? But it is mainly for citizens of Trinidad and Tobago. But in that narrow window of persons who are not citizens but who need to be here, Because we are managing the entry on a case-by-case basis, when an application is made by a person who is not a citizen, a decision will be made as to whether an exemption should be granted. So an exemption would have been granted to ambassadors who are coming in. And of course, if there is a father whose wife and children are in Trinidad and Tobago, but he is not a citizen of Trinidad and Tobago, the ministry will consider that and make a decision. And more than likely, we expect that it will be granted so the family could be reunited. So that is how that is handled, on a case-by-case basis. And the first part of the question about whether the borders are going to be open, let me go back to the 330,000 people who are outside of Trinidad and Tobago who live out there, because I think we've dealt with those persons who were caught outside, who had traveled temporarily and were caught when we closed the borders. Those persons would have been up to the applications up to August. We took it to mean that if you were caught outside in March when we closed the border and you had not applied to come back home by August, then you really were not coming back home. But by August 31st, all those persons, or the majority of persons who were caught outside by the sudden border closure and who wanted to come back home, we would have allowed them back in on a phased basis, and we brought back home approximately 5,000 persons. However, that 330,000 people, the majority of whom live in the United States, about 275,000 of them, in that population, many of them want to come home, one of whom is my own daughter, who haven't been home since last January thereabouts. Those persons are also required to apply to come in. And we don't just open the border and let them in, for the simple reason that the United States is now one of the most highly infected countries in the world. Not just New York, not just Florida, but across the United States. Unfortunately, that is so. We can't do anything about that. But if we open it and they come home by the thousands, the very system that we have put in place, which is the parallel health system, will collapse. Because in that population of likely persons who could come in infected, when that population joins us here in Trinidad and Tobago, if we get spikes generated by that, and we end up with people who need health care beyond the capacity that we put in place to treat with people who would need high-intensity health care, that is when we're going to fall down. So we are saying, yes, there are certain screens put in place that persons wanting to come home should get a PCR test within 72 hours, only to discover that many of them can't get that test. A PCR test within 72 hours is not available in many instances. And the other test, the fast test, is in many cases not the standard we want, but we are now discovering that it may be possible. Carl and the CMO office, there's another test that we can probably use, which persons abroad can get to allow them to be screened on the way in. And we also said a fortnight ago when I met you that we do know that very many people would want to come home for Christmas, and we'll want to allow as many people to come as possible. So we got a protocol in place where if you got the test, can get in, and you want to go into the state quarantine, because we have to maintain quarantine. If we don't maintain quarantine, then everything that we've done since March would fall apart. So when you come in, you will have to go into quarantine. The state quarantine, which is free, and the numbers we manage. And if you don't want to go into the state quarantine and you are prepared to accept your exemption and pay for quarantine in designated hotels, that is under state supervision, that is also available, and that will allow a larger number of persons to come home for Christmas. But whoever comes in, there's a 6-day element of quarantine. And we, you would have heard last time we said on the 6th day you'll be tested, and if by the 7th day your test is negative, you can go home for Christmas. But if you want to come home for Christmas, you've got to travel at least a week before Christmas, otherwise you'll spend Christmas in quarantine. So these protocols are in place, and our doctors here in Tobago and in Trinidad, and our daily or every other day report will keep managing this. Carl is also linked in its operations with the ministry that is granting the exemption. So once you get your exemption and you turn up at the airport with your test, whether it's a PCR or otherwise, then you come home to Trinidad and Tobago, and once you get here, you have a 6-day quarantine, and on the 7th day you're negative, you can go home and remain with your family. And even when you do that, we ask you to remain family focused and not party and so on. So that's the general scene for Trinidad and Tobago.
I don't know if you could look into the matter in light of the Minister of National Security not being here. A flight was expected from Canada, and some nationals who were supposed to board this flight on Wednesday, they were turned back. Even though they had their PCR test, the airline would have told them something different. I don't know if you're aware of that.
I couldn't speak to that because I don't have that information. I'm totally unaware of that, but I couldn't see if they were carrying exemptions and they had their PCR test that was not older than 72 hours, I really am to be advised as to why they would have been denied access.
Yes. Okay. I know you spoke about the behavior of citizens during the Christmas towards the reopening of schools in January. Is it that you are waiting to see officially the results in terms of health, COVID-19? You're waiting to see the results after Christmas into January before making an announcement about the reopening of schools?
Absolutely. When we live through the Christmas, it will begin to show itself in the statistical expressions within a few days after New Year's and going into, in that 14-day period, by mid-January. So if we're thinking about opening school by sometime during December, we will set a date for, and it's not the whole school population, it would be a certain cohort we'll start with. And when we put that date in place, it will be controlled by what the data is post New Year's Day. Because look at it this way, it would make no sense for us to have protected our people for almost a year, and then we end up with a huge spike in January, and then say, okay, we can let them out. It's the same virus. If the condition is bad, we will not be able to put children out there. But if it is reasonable and I would say usable, we are monitoring it on a daily basis. We are looking at the statistical aspect of it, because the funny thing about this is that you have to look at the statistical curves. I must say I was very pleased I did not miss my statistics class when I was in Mona. I didn't like it at all when I was forced to do statistics. But when I sit down with Dr. Hines and look at the numbers, I understand regression curves and I understand the steepness of a curve on a projection today and where it's going to be. And for the public, the doubling of our numbers on a 7-day cycle is what will give you an idea as to where we're going. If you're seeing us doubling the numbers in a short period of time, then we're in big trouble. If we are doubling the numbers over a longer period of time, then that gives us a little more comfort. But of course, you can project where you're going to be ahead of time based on where your curve is now. So if, when we finish our Christmasing and our New Year'sing, depending on what numbers we get during the first week of January, which is the early part of the incubation period for that behavioral period, then we would know if the opening of school could be effected as promised sometime in early December.
Just 2 other questions before hopefully I get the mic again. In terms of the anti-gang legislation and the opposition abstaining.
Let's finish the COVID thing first before we go to the anti-gang.
All right. So moving along, in terms of churches and weddings, is it that churches remain 1 hour, weddings remain 20?
No, we give an extra half an hour. Churches are 90 minutes now. Yeah. Okay. Church services are 90 minutes, and that will apply.
Some are asking for even more time to pray and worship.
I told you about the preacher who said that nobody in God's house would get sick. And he died within a fortnight. That remains intact.
I don't know if you can also look at a situation where I would have received a call from a fisherman today who stated that...
No, Liz, don't tell me fish getting COVID.
No.
Oh, okay.
No. Okay, so I received a call from a fisherman today who stated that 2 persons were stranded out at sea at this time in terms of in Tobago off Castara, but they stated that when they called the Coast Guard said that there were no patrol boats available. I don't know if you can look into that.
Well, I'm sure that the Minister of National Security is following us. He's following this program, and he would have heard that, and he would get to it immediately. I don't know what the circumstances are, but if people are out there and need help, help should be available from the Coast Guard somewhere, either from Scarborough or from patrols who are out at sea. Yes.
Good afternoon, George Leacock.
Mr. Leacock.
Radio Time Britain. Prime Minister, you said partying and Christmasing. I have another thing for you.
Which one is that?
Campaigning. TEEJAH election.
Thank you for thank you for mentioning
and I
that.
noticed nobody mentioned whether the minister will be putting in place special protocols, so how this campaign would take place to keep us safe over the Christmas period. So that's my first.
Well, let me answer that one time. Campaigning is one kind of activity that could cause congregation of people. And because there's an election here, it's due sometime in the early part of the new year, it would behoove all of us to campaign differently. Yes, there'll be campaigning, but nothing that involves the congregation of people should be encouraged. And I'm sure that there are aspects of campaigning that could be had